explaining the importance and empowerment of cardiovascular disease, no matter where you are globally, right? So every month there's kind of a theme of, oh, it's stroke awareness month or blood pressure awareness month, which is in May. But to me, it's like every day is kind of that time where we can do one little thing that can help us improve our life and help and increase longevity and really prevent disease, but also complications of current disease or conditions you may have. So I'm all about empowering and trying to give that information so that we could be our own advocate for ourselves, and also ensuring that we could do whatever we can in our power to improve our health, because we can all improve our health, and it doesn't need to be a big thing. We don't want to be overwhelmed by it. We have so many things going on in our lives, but really looking at it from a perspective of, well, what can we do today? What can we do right now? And how can we make these into long-term habits? Because you following a trend for a week or a month or a couple months is not going to help protect your heart. It's really looking at it from a long-term perspective of merging this science-based nutrition into your everyday lifestyle, into the foods you like to eat, into the things that make you happy and the things that work for you. Because not everything's going to work for everyone. That's why we can't just say, here, do this. If we could just say, do this, and that's it, then we wouldn't be having cardiovascular disease globally. It's the personalization key that we really need to focus on to ensure that this is something that's lifelong and really protecting your heart. So I'm so excited to talk with you and just emphasize this, but also give really hands-on practical tips today to those.
Really excited that you're here, and also we've had so many questions. I apologize in advance. We've had so many that I don't think we'll be able to get through all of them. However, Michelle will, before she leaves, give us all of her details so that she is able to be contacted, and she'll give us all of her information so that if anyone has any questions afterwards, they can always be in touch. So shall we just start off by, if you could introduce yourself and just give us a brief summary into what you do and how you help people, and then we can take it from there.
Yeah, sure. Thank you so much for having me. My name is Michelle Routhenstein. I'm a registered dietitian nutritionist who specializes in heart disease management and prevention through science-based nutrition. I'm all about creating awareness, because when we look at the very limited risk factors that are in a traditional model, we're looking at a very small piece of the puzzle when it comes to heart disease and chronic disease management. So I'm about explaining who's at risk, and if you're at risk, what do we do about it, right? So being more proactive in our heart health, and also a healthy diet is great, but a healthy diet means so many different things to different people. Most people who come to see me say, I do follow a pretty healthy diet, but when we deeper look into it, they're missing a lot of key nutrients that they need for optimal cardiovascular health. And so my specialty really places it where you're really assessing your blood vessel health and making sure that we are doing what we can to prevent the LDL and the glucose and all the things that are not supposed to be in the bloodstream from becoming oxidized into plaque. And so when I focus in on my clients and everything that I really speak about, it's about how do we optimize blood flow, blood vessel health, and allowing our heart to beat regularly and to optimize its function. So I'm all about blood vessels. I'm all about heart disease, but without impacting another organ. So I don't believe in only looking at one small picture. We need to look at the whole picture. But if your heart is not functioning optimally, you're not going to have good blood flow to your kidneys or your pancreas or your brain or any other organ. So we really do need to optimize your cardiovascular health, but never looking at it by deteriorating another organ at the same time. So it's always looking at the whole person approach to optimal health. And so I do a whole person approach to cardiovascular health, and I love what I do. I have a very big passion for it, and I'm on a true mission to really reduce this from being the #1 killer globally. Like 80% of it can be prevented through science-based nutrition and lifestyle. So hey, we need a little bit more assistance, and I think a big part of it is awareness is key. Knowing your numbers, understanding it from a perspective of, well, what can we do about it? And being more proactive is the first step in that journey, and to really help lower this grueling statistic.
That's great. And 100% agree with you. I think that this is such a big deal, but I also am so proud that through social media and accounts like yours, people are really now becoming aware of their health, and they're trying their best to understand their own health, understand what certain figures mean, their blood tests. They're taking more autonomy with their own results and their own health. And I think it's great that, you know, now people are wanting the education, and hopefully we'll be able to guide them into, you know, trying to get things just sorted so that their future is optimized as much as possible. So just to start off with, without any background of heart disease, how would you go approach the patient who attends your clinic, who doesn't have any significant risk factors, but does have a family history of cardiovascular disease, but they really just want to delve deep into their nutrition and to really find out what kinds of things they need to cut out or add in to help with their heart health? How would you approach that type of a patient?
Yeah, so I have two different ways that I approach this. So one, there's a lot of people who come to me because they unfortunately have a family history where their either mother, father, or grandfather passed away at an early age from a sudden coronary artery event, or their parents have had many bypass surgeries and they don't want to live that life. They're nervous of living that debilitating life, or they had a stroke and so on and so forth. And people just want the education. Well, how do I implement this? And so I have a 6-week group program where I go through the underlying root causes of cardiovascular disease and explain this to them. But that's one group. There's another group that they're not necessarily sure about their family history, but they get a lipoprotein A, which I believe everyone should get. It's a test that basically assesses your genetic risk of atherosclerosis. And if that level is high, they want to be more proactive. So no matter if they start in a group program or an individual program, my individual program, I do a little bit more of a thorough assessment to see, you know, is there inflammation? Is there oxidative stress? Is there insulin resistance? Is there something brewing that could cause the potential for plaque to progress or be promoted in the arteries? So there's two different kinds of setting, but either way that we look at it, we need to start with where the patient or the client really is in that moment. Meaning, you know, are they somebody who has already taken a heart health journey and want to make sure that they're doing everything right? So everyone comes and asks me, what's the most heart healthy diet? And I don't really, you know, if we look at the research, we've seen, you know, the Mediterranean diet, the DASH diet, vegetarian diets are all very heart healthy. But at the end of the day, everyone defines those diets in such different and vast, you know, they're very different in how you describe them. I've seen vegans who are deficient in over 10 to 15 vitamins and nutrients that can cause atrial fibrillation. I've seen vegans who've had a much more well-balanced diet and who are, you know, just need a couple of tweaks. But you know, you can be a heart healthy vegan or a non-heart healthy vegan. There are a lot of vegans that have a lot of their foods are very high in saturated fat, for instance. And then on the contrary, I've had people who said, you know, I can't give up red meat. And so the point of me saying this is I am not going to come and tell you that everybody needs to be vegan in order to protect their heart. I'm going to work with you where you are and what's realistic long term. I've seen a lot of people try very restricted diets and they become malnourished from it. They have unintentional weight loss that they're not trying to lose weight, but they're losing muscle mass because of it. And these are primarily a lot of people who go on a no oil diet. So I'm very big about what's realistic long term and by implementing science-based nutrition. I'll admit to you this one thing though, every diet that is going to be heart healthy is going to be a plant-forward diet. It's going to be rich in plant-based foods. But with that being said, if you just focus on one category of vegetables or one category within plant-based, you probably are going to neglect certain nutrients that are in other parts of it. So I teach you kind of which foods are high in nitric oxide, which ones are rich in glutathione, which foods are actually going to help enhance the pathways that reduce oxidative stress, that help with vasodilating, opening up the arteries, and making sure we're getting all of those for optimal nutrient sufficiency. So when people ask me, what's the heart healthy diet? I say it's any diet that has it's nutrient sufficient, where we're getting all of the vitamins and minerals your body needs for optimal blood flow, for optimal blood vessel health, and for making sure that we're not promoting that plaque in the arteries. And that all is also based on you, right? Food is so ingrained in our culture, in our day-to-day, in our lifestyle, in the accessibility of it. And so we need to take that into account when we're giving advice, which is why no one diet is going to work for everyone. And so we really need to assess where it is you are. What are some things that are maybe causing more of the heart disease risk factors? So for instance, if you have psoriatic arthritis, I can never say that word. If you have gout, if you have fatty liver disease, depending on what you might have as another condition, that might be a red flag in my book of, oh wow, you're dealing with insulin resistance, or you're dealing with too much inflammation. And that's where we would focus first, because that's going to help with many of the risk factor reduction strategies that we need to implement in order for optimal heart health.
That's great. And that brings me on nicely to my second question about intermittent fasting. One of the questions that was submitted was, lots of people are encouraging intermittent fasting. Several studies, actually conflicting studies, have said that they're good and that they're bad. But from a cardiac perspective, what would be your take on, the intermittent fasting diet, where there's a period of starvation and then you break your fast with either highly fat dense foods or nutrient-rich foods, and then there's another period where you can eat again, and then you have either a 16-hour period where you don't eat again until you have your next meal. What do you think about that kind of a diet or regime?
So there's a couple of comments that need to be said. One is, I'm okay with intermittent fasting where it's a 12-hour fast, right? You're giving your body the digestion, the time you need to kind of, take off, close digestion, work on the other restorative processes that it needs to do, right? So if you are fasting from 7 p.m. to 7 a.m., there's no problem with that. When I've seen people come to me and be on 20-hour fasts. Now, take a step back. I feel like a lot of times when we look at fad diets, no one takes a step back and actually thinks like, can my body do this? So think about it. If you're only eating for 4 hours in a day, how are you going to get all of the nutrients your body needs in order for it to work? You're not. But then think about it on one more level. You are going to be so hungry and try to eat so much in that 4-hour period. You're going to give it so much, your body so much food, it can't process that much. So you're increasing the metabolic load. And so what happens in that 4-hour period, your cholesterol is high, your blood pressure is high, your glucose is high, your body is in overdrive. It's like, I can't deal with this much processing at once. So from that standpoint, no, I don't agree. 4-hour time period window of eating is not enough. If you are ignoring your hunger signals, or you're like, oh my God, I can only eat for this many time, and you're engorging food, that's not working for you and your body. The other issue is can you do this long term? Because if you can't, you're going to ruin your metabolism. And the second you go back from it, you're going to gain back that weight. Yeah. The studies show that intermittent fasting is beneficial from a longevity or from a chronic disease standpoint are looking at solely based on caloric deficit. Yeah, if you don't eat those calories, you're going to lose weight in that time period, which is going to reduce, especially if you lose weight around your abdominal region, it's going to help with inflammation. It's going to help with certain markers. But we need to make sure that it works for your metabolism and that you are not taking medications that need to have food with them, that you are listening to your body and shifting the food at least to eating more in the morning and stop eating at night, because your insulin markers are able to process food better in the morning than at night. And so certain aspects of intermittent fasting can work with your diet, with your lifestyle, but A, it needs to be personalized, and B, it cannot be more than, 13 to 14 hours, especially if you have diabetes, if you are on certain blood pressure medication or special heart medication. You want to be very careful with this remark and making sure we're not overdoing our metabolic load and listening to our hunger scale and our hunger quotient.
Absolutely. And I think it's the foods that you end up eating that will determine how you go about and whether it's sustainable or not. So yeah, I mean, I often get asked about intermittent fasting too, and it really is based on what people decide to eat during the periods where they're eating, and also how long they're starving their body for. The longer they starve their body, the more likely they're going to be really trying to replenish those cravings quickly, you know, and they're not going to be reaching for those nutrient dense foods as often as they would for the ones that give them satiation. So I think that's really, it's one of those things that's quite dangerous too.
Exactly. And I also think you mentioned like there's times where people will just eat a very high fat meal afterwards.
Yeah,
And especially for those watching who have FH or familiar hypercholesterolemia, your body cannot digest high quantities of fats. So that can also cause a lot of detrimental impact on your body as well. We really need to look at a well-balanced meal whenever we're looking at these things to ensure nutrient sufficiency, but also for optimal digestion of these nutrients as well.
absolutely. You mentioned about LPA levels, and for those that are watching, in the UK, we do not offer that blood test unless patients have been identified as high risk. So LPA stands for lipoprotein A, and often these are usually tested in a specialized lipid clinic in the United Kingdom, only on people who have been identified to have a higher risk of cardiovascular disease, and that's based on them having a cardiac event prematurely, so before the age of 40. So anyone who's had either a heart attack or an acute coronary syndrome before the age of 40 in males and 50 in females will be identified as having premature cardiovascular disease. They will have a lipid check, so they will have their cholesterol levels checked, which includes their LDL, which is their bad cholesterol, and their HDL, their good cholesterol, and their triglycerides. And they will be referred to a specialized lipid clinic where they will have these blood tests incorporating more specialized cholesterol tests, such as lipoprotein A. And what we found in people who have premature cardiovascular disease is that their levels of this lipoprotein A are extremely elevated, and no one really understands the significance of why they're so elevated. But the key is, and the pattern is, that these people with significant cardiovascular disease who have it prematurely all have extremely elevated LPA levels. And so if any of you are watching and who have been diagnosed with familial hypercholesterolemia, which is a genetic condition where you have high cholesterol, circulating cholesterol in your body, which predisposes you to premature heart problems, strokes, peripheral arterial disease, anything that goes along with having high cholesterol, you will be often have very high LPA levels, and you'll be asked to take a specific diet to ensure that your cholesterol levels go down. But in the United Kingdom, we're doing a lot of trials now looking at the significance of LPA levels in certain conditions. But for those who have familial hypercholesterolemia, the question that I've been asked to pose to you is how in your nutrients or how in your daily foods will you be able to lower the LPA levels? Is there anything that is specifically helpful for that, or is it more of a general diet that would help lower the LPA levels?
So a couple things. So I find that that's I find that very sad and unfortunate to hear that someone has to have an event in order to get an LP little a, because that could have been prevented if we were more proactive. So if LP little a was a standard routine blood test, and in the United States, you can ask your physician for any test. And so this is one of the tests I do recommend in my blood test course that I have that you should be asking, because if you knew at the age of 30 that you have a high LP little a level and you're at an increase of a premature heart attack, that is scary, but I don't want you to look at it from a scary standpoint. It's a preventative standpoint. If you could prevent a heart attack, like, you do everything to do that, right? Because that can cost you your life. So we should use it as a preventative marker. And it just drives me crazy that in so much medicine is about treating, but like, hey, there's a prevention arm. So ask your doctor to check your lipoprotein A. If it's not covered by insurance, you can you know, I think it might cost in the US anywhere from $50 to $75, but it's so worth knowing that test, because while you have a lipoprotein A, a lot of studies aren't really showing a necessary reduction. There are some foods that have been shown to lower it, but if yours is elevated, what we need to do is be extra proactive from a cardiovascular standpoint. So to back up and explain, if you have high LDL levels, you can have high LDL levels that don't become oxidized and lead to plaque formation in the arteries. It's the oxidation of LDL, calcium, cellular waste, things that are in the arteries. When that becomes oxidized, that leads to plaque formation in the arteries. So if you have a high lipoprotein A, you need to make sure that we are addressing inflammation, we're addressing insulin resistance, we're addressing oxidative stress, we're addressing endothelial dysfunction, and we are optimizing every single risk factor on your blood tests. And there's so many blood tests I look at, but that goes from homocysteine levels to our CRP levels, to our LDL, to our advanced lipid profile, to our insulin resistant markers. We need to make sure we're doing everything we can to lower your ultimate risk, because we know that people who have an elevated lipoprotein A level are at a very high risk for atherosclerosis. And so I use it more as a preventative sign and things that we can to help prevent it. I've heard so many stories of people come to me after a heart attack, then they don't want a second heart attack. And they're like, I wish someone had actually tested all these things you're telling me to test before my heart attack. And the fact that we do it backwards drives me nuts, which is actually why I created my blood test course. I was like, we need to have people to be more empowered. I love physicians. Physicians are amazing, but you guys have so many things to do. And it's hard for you to be on top of every single patient. You have to prioritize that caseload. So I don't blame anything on physicians. It's that we as individuals need to be more proactive in our care. We need to come to the physician doctor and ask questions. Look at our blood tests. I can't tell you how many people say, I've never looked at my blood tests before. I wait for my doctor to call them. No. You need to look at your blood tests and see the trends and see what's going on, because you're the only one at the end of the day who can take action and help reduce your risk of cardiovascular health and disease and all these conditions. And so important to know your numbers, but then optimize them. And we know that nutrition and lifestyle has such a big role in this. I've seen it. I've been wowed by nutrition, and it's crazy how I've seen things in my practice that I didn't think was possible. I've seen ejection fractions go from 15%, to 65%. I was like, one of my clients, his wife called me. She's like, Michelle, are you sitting down? I'm like, yeah. She's like, his ejection fraction is 65. I'm like, he just had bypass surgery 6 months ago. What do you mean it was 15? She's like, yeah, the doctor doesn't know what he did, but says he needs to continue whatever he's doing. The power of nutrition is so beautiful, and I love seeing it, but we need to be proactive in that. And proactive just means understanding what's going on that could be brewing more things in our arteries.
Absolutely. So moving on, because we don't have much time left, but I had a couple of questions. One was, my mother has high blood pressure and only eats foods that contain Indian spices, so curries, etc. She doesn't enjoy eating anything else. And would you recommend any particular methods to make the food or that kind of cuisine healthier? So would you suggest increasing or adding anything into those spices that would give it a little bit of a healthier addition to the meal, especially similarly, I treat lots of people who are from a South Asian background who are just unable to change their diet completely, but are more amenable to making small tweaks to their diet that they are happy to do, because that's something that they can sustain and they can enjoy, but also know that they're doing something actively to be able to help their heart. Is there anything that you would suggest?
Yeah, so you don't need to change your diet drastically in order to see an improvement. I've seen a lot of South Asians as well. They're at a higher risk for cardiovascular disease. And I'm not going to tell you never to have a curry again. I want you to enjoy your food. That's the other thing. Heart healthy diets are usually equated with bland and boring. I
Yeah.
love eating and I love good food. If my food doesn't taste good, I'm not going to eat it. And I follow what I say because I feel better. I get all my nutrients this way too. So curries are definitely acceptable. One thing to note is actually Indian spices are very, very protective from a heart health perspective. A lot of them have antioxidant and anti-inflammatory components, specifically like turmeric and black pepper and cumin and fenugreek. Use those spices, enjoy those spices. What I would say though, in terms of small tweaks, it really depends on which curry, but look at the composition of what it is. How's the oil amount? Are we using coconut cream? What are we putting in there? Can we switch that, or can we cut it in half and replace it with a healthier oil or a healthier substitute? That's one. The second thing you could look at is what protein is going in the curry, right? There's a lot of curries that you could use dal and you could use mung beans and all these things that are very high in potassium that actually helps to reduce tension in the arteries, which help with blood flow. So maybe we assess the type of protein that's going in the curry. The third thing is maybe we can look and see, what vegetables are we putting in? What vegetables do we like? Can we increase that ratio? And that way also increase potassium. And also maybe we take a variety within the different types of curries, right? You have red, you have so many different beautiful colors and different vegetables that go in each curry. Maybe we can expand our regular to-do and help that way too. You also want to know, what are we putting on the bottom of the curry? Is it white rice? Is it brown rice? Can we maybe choose a different whole grain that we can put there, which has a lot of magnesium and B vitamins, and that also helps with reducing blood pressure. So many different things we can do, and I think a lot of times we just have in our head, oh, this is what we eat and it's not going to be heart healthy, but small tweaks here and there actually make a very big difference. And so taking that also with you and trying to expand that way, you don't need to change your cuisine. I want you to enjoy your cultural foods. We just can make a small tweak here and there, and that can definitely help improve your blood pressure.
I think that's so important, and I think that's really helpful, because the small tweaks and the small things that you can substitute are the important things, because then we're happy in both ways. You can enjoy your food and also know that you're having some nourishing food that isn't going to cause you, too much damage. And this is something that you'll be able to sustain for a long time. So that's great. I'm conscious of the time, Michelle. It's just after 8, and we were going to talk only for 30 minutes. Time has flown, so thank you so much for joining. And also to anyone who has joined the live, thank you for joining. Please do go and follow Michelle. She posts some really, really informative content on foods that we naturally see, and how nutritious they are and how they benefit the heart. So she talks a lot about the inflammatory diet. She talks a lot about atherosclerosis and foods contributing to atherosclerosis. She talks a lot about calcium scores. She talks a lot about the things that we see day in and day out. And in the United Kingdom, we don't really have the luxury of having a cardiac dietitian often in our clinics. And that's something that I think is really important. So often patients ask us what to eat. And although we can help with the medication, the dietary and nutritional advice is something that we're lacking. All of us are lacking in training. And I think it's something that is really helpful. So I'm really glad that you had you could take the time to come and join us today for the live. So yeah. I will leave it there because I know you have some commitments. Would you mind if I just quickly flick through the questions? Fasting for dementia. I have read that fasting helps with that. Okay, we won't be able to deal with that today, unfortunately. There was another one about, is ectopic beat normal? Perhaps I can do a live on my own to answer some of these questions, because this isn't really to do with Michelle's specialty. And hey, Michelle, great job. I will conclude on that. Okay, Michelle, great job. Thank you very much. Thank you to those who joined. I will save this live, so if anyone wants to watch it again, please, you'll be able to do so. And yeah, take care. Have a lovely rest of your day.
You too.
Take care. Bye.
Bye.